calories in, calories out is true, but it's the lowest level of thinking that you can get and the least useful, because you're not actually getting to the root cause, the sort of lowest level. And they never get to that, what is really controlling that sort of calories in, calories out. And it's like, well, if you look at calories in, what's the main control? Well, it's like hunger, obviously, which is a hormonal issue. And what's the control of calories out? It's not exercise. It's mostly basal metabolic rate, which again is hormonally mediated. So everything works on hormones. And the main one, of course, is insulin, which is the one that I had been prescribing. We have a hypothesis that insulin causes obesity. So give insulin. Do you get fat? And the answer is yes. I was like, didn't you just answer the question? And the second part of that experiment, if X causes Y, take away X. Does Y go down? So take away insulin. Does obesity go away? And the answer is yes, it does. If I give insulin, do they get fat? Yes. If I take away insulin, do they get thin? And it's like, yes. Well, that's really all you need. Like the intermediary steps, whether it's calories, whether it's basal metabolic rate, whatever you want to do. This is a root cause analysis. And so I did try a low carbohydrate diet at first, and it was quite effective. I actually lost weight quite quickly. I mean, it was very interesting that it was actually way more effective than I thought it should be or would be. And, you know, my weight really came down a lot, and it's like, oh, this is really, really interesting, because this is actually what I've been looking for. And that's where I started to really blog about it. And I was looking back, it was like 2013, I started blogging about it and developing a program, which eventually became thefastingmethod.com, about low carbohydrate diets. And what was interesting was that I started with low carbohydrate diets. And my patient population is skewed because I'm a specialist. So mostly I had older patients, and in Toronto, mostly like ethnic population. So I could talk to them about low carb and this and that, but they didn't really understand what I was talking about. Like, you know, you'd say, oh, eat low carb, and then you see what they're eating. It's all rice and noodles. The point is that you don't have to necessarily go low carb, because there are other ways. What you need to do is lower insulin. And really, that's when I was talking to somebody, and they're talking about doing cleanses and fasting. Is interesting because she had lost a lot of weight, and she said, you know, somebody had told her, one, eat lots of fat. And I thought, wow, that's really strange, but it worked really well. And two, she did all these cleanses, which I thought, well, that's really stupid. That's just like fasting. And fasting is obviously bad for you, right? I thought it was terrible. That was my gut reaction, as was everybody else's when I started talking about it. And then I thought, okay, well, how does this work? Because what you're going to do is you're going to lower insulin. If you lower insulin, you know that you're going to lower your blood sugars, which is good for type 2 diabetics. And after that, you're going to metabolize fat, because that's what body fat is. It's simply a store of your calories. And we know that insulin inhibits lipolysis, so that if insulin is high, you can't burn body fat. You don't want to. But if it falls, you are going to activate lipolysis. So that seems good as well. And so I'm like, everywhere I think about this, you know, it just seems good. Like the whole thing seems like exactly what you want to happen.